Testicular cancer occurs when malignant cells develop in the testicles. Testicular cancer is relatively rare in comparison with other cancers, with about 10,000 cases diagnosed in the United States each year. However, it is one of the most common cancers in young men between the ages of 15 and 35 in this country. There are a few known risk factors for testicular cancer. One is a history of an undescended testicle. This occurs when one of the testicles does not drop into the scrotum during or shortly after birth. Even if a surgery is performed to place the testicle into the scrotum, men are still at increased risk for developing testicular cancer. Another risk factor is a family history. If a man's father or brother had testicular cancer, he will be at significantly higher risk of being diagnosed. The most common sign of testicular cancer is a painless lump or mass in the testicle. This is most commonly found during a self-exam. When men with a testicular lump are referred to see us, we perform a physical exam and obtain a scrotal ultrasound to confirm if a suspicious mass is present. Ultimately, the only way to determine if a testicular mass is cancerous or not is to remove it. This is typically done during a short outpatient procedure called a radical orchiectomy. During this procedure, we remove the testicle through a small incision in the groin. We then look at the tissue under the microscope to see if there are cancerous cells present. Once a cancer is diagnosed, we then perform a CT scan and also some blood tests to see if cancer cells have spread to other parts of the body. The vast majority of men who have a single testicle will have normal hormonal function, sexual function, and fertility. Men have the option of having a testicular prosthesis placed at the time of radical orchiectomy, so it can look and feel as though both testicles are present. Testicular cancer is a highly treatable disease, and the vast majority of men can be cured. There are several treatment options depending on the aggressiveness and extent of the disease. Importantly, because there are many treatment options, it is critical to select the treatment that optimizes the balance between cure rate and potential complications. Many men with testicular cancer that is confined to the testicle are cured by radical orchiectomy alone. The only additional treatment these men require is close monitoring, which is highly effective for well-selected patients. For patients that have more aggressive or advanced cancers, other treatments may be needed, including chemotherapy, radiation, or additional surgery. While only performed on a small percentage of testicular cancer patients, a surgery called a retroperitoneal lymph node dissection is sometimes required for men who have cancer spread into the abdominal lymph nodes. As with many complex surgeries, it is important that patients have this done by an experienced surgeon. Because there are many treatments for testicular cancer, and some patients require more than one type of treatment, specialized teams of doctors are needed. Here at Columbia, we have an experienced team of medical oncologists, radiation oncologists, urologic oncologists, pathologists, and men's health specialists to help manage our testicular cancer patients. If you are concerned that you could have a testicular cancer or have already been diagnosed, please call the Columbia University Department of Urology so our team can help you.